Hey guys, welcome to Rationality, Reason, and Reality. I'm Supernova. I'm going to take a bit of a different tack from my usual thing and do a bit of book criticism, or rather some idea criticism of Stephen Levitt and Stephen Dubner, the authors of Freakonomics, Super Freakonomics, Think Like a Freak, and their book that came out just a couple weeks ago called When to Rob a Bank. Now, I generally agree with these guys. I love everything they have to say. I listen to their Freakonomics podcast on iTunes most weeks. And I've read all their books, and I think these guys are very rational and usually very clever. But in Think Like a Freak, I took issue with something that they had in the very introduction where they talked about going to England and talking to David Cameron about the healthcare system there, and I heartily disagreed. And I made a video, and like most of my videos, I didn't actually go ahead and upload it. And I'm kind of glad that I didn't, because I was thinking at the time, well, they're really smart guys. They'll probably figure it out. They'll realize where they went wrong. But they didn't. In When to Rob a Bank, which is a collection of a bunch of their blog posts, they talk about that part of Think Like a Freak, and they mention that they got some criticism for it. Instead of correcting their mistake, they doubled down. They basically held on to that position and added to it. And now I have to say something. I have to criticize this and upload it, and hopefully it'll come to the attention of Levitt and Dubner, and maybe they'll learn something from it. So what they actually said in Think Like a Freak is that they went to England and they talked to the Prime Minister David Cameron about how bad his idea for paying for health was. In England, they have a single payer system. It's not quite socialism. They don't own the hospitals. The doctors are not government employees, but everything is paid through the government. The people don't actually have to pay for their health care. And it's very expensive for the government because health care is expensive. And they were suggesting basically, hey, scrap this idea. It's a bad one. They presented him with the analogy of transportation. They said, what if cars were to suddenly become free and people could consume as many cars as they wanted? And David Cameron said nothing. He basically just stood up and left and dismissed their ideas. And they blamed it on bias. They thought, hey, we had a great idea and he was just biased. But I'm thinking not. Because I had practically the same reaction when I heard it. I thought, wow, these guys are really smart. And that is one of the dumbest analogies I've ever heard. Because healthcare isn't something that you can infinitely consume. It's not a consumer good. It's something that you get when you need. Like most of the systems that we have that are socialized are like healthcare, and it's just not comparable to cars. But even if we take that analogy at face value, I don't think they've thought it through very carefully, because if cars became free, well, the economy would flex and evolve to work with free cars. Cars would become disposable probably. We wouldn't have mechanics. They'd be very cheap, and they would be made so that you could take a new car when you needed transportation. They wouldn't exist in their current form. You'd think if cars went free all of a sudden that people would hoard cars, and initially they probably would, until they realized that cars have no value. You can't resell them to anybody if they can also just go and get as many cars as they want. We try to think of an analogy like this in limited views. We think free for us but not free for everybody else. But if it were free, we treat it like other things that are free, like tap water. You can get as much as you want of it right now. Why aren't you hoarding it? Why aren't you consuming as much tap water as you possibly can? Well, because there's no reason to. If you need some, you just go to the faucet and you get some more. There's no point in over-consuming it because it's always there. It's not worth anything to anybody else. You can't sell it to any of your neighbors. It is kind of a good like cars, but it has no value because it's free to everybody. And that's what it would be like if we made cars free. It was a very bad analogy. It should have been compared to services. And there's a good reason why all of our services are socialized. If you weren't aware of it, our military protection, our public schools, our police and firefighters, they're all government agencies, our public politicians. That's socialized. We pay for them in taxes, but we get their services for free. Every time you call the police, it's free. You don't have to pay anything, no matter what they do for you. It's not going to cost you anything. It's socialized. We pay for it in local taxes. And that's why I think that healthcare ought to be like, also for some very good reasons. For one thing, it's for public good, and I'll get into that a little bit later. But for another thing, it's because of the cost. It doesn't work in a market system. But that's the problem. Levitt and Duvner, in their newest book, When to Rob a Bank, actually propose a solution to this. They say, instead of a single payer system, how about we give everybody health vouchers? They just threw out a figure, $1,000 a year, but they weren't solid on it. They're saying give everybody a certain amount per year, and they can spend that on health. And of course, they can't overconsume it that way because they only have so much. And that's just a really bad idea, because health, it shouldn't be subject to market forces. There are two really good reasons why this is such a bad idea. Number one is that we don't know how much healthcare costs. I mean, if I have a voucher and I have something wrong with me and I have to go to the hospital, I don't know if I'm going to be able to cover it. I don't know how much my services are going to cost, and so I can't say, well, I've budgeted money for this and I can go. I simply can't do that. And the hospital isn't going to be very helpful either, because we have systems for an unknown cost when you don't know it's wrong, such as a garage. If you take your car in, the mechanic will diagnose the problem, and then he will give you a figure and say, hey, can you afford this? Do you want us to fix this? They don't do that at hospitals. They probably ought to, and in this situation maybe they would, but at the moment their diagnosis can cost you a lot. In fact, I have health insurance through my employer, and I went to the hospital last year with a heart problem. It turned out to be nothing. I was probably just under stress, but I had heart pain. So their regular system, everything they do for everybody who comes in with heart problems is an EKG and X-ray and blood tests, and it was all diagnosis, and they found that there was nothing wrong with me, so they didn't actually have to give me any service. But for the diagnosis alone, after my health insurance, it cost me $2,400. That's a lot, and I'm a healthy guy. I otherwise never go to the hospital. Most years I don't visit a hospital ever, even once. And so not only would it be incredibly hard for me to budget, but this is just to find the problem. It's rather expensive, and you can't go to the hospital and say, I have $2,000. Will this be enough for the diagnosis? Because they don't know. It depends on if they find anything for the various tests. So it simply doesn't work. And then after that, they might be able to tell you how much it would cost, but especially if you're taking a hospital stay or whatever, there's just too many unknowns for them to give you a cost. You simply can't afford it unless you have way more than you could possibly need. Number two, this is way more important, even if it wasn't for that first reason. There's a really good reason for us to have socialized systems in police protection and firefighting. Let's say that your house is on fire and you can't afford to call the firefighter because it costs money, and you just don't have that money. It's a public health risk. Your fire may spread to the neighbor, and because of whatever caused your fire, they might lose their house too. You simply can't allow for that. No government would ever allow that to happen. And so we have free firefighting service. If your house is on fire, you can call the firefighter and they'll put it out, because it's a public danger otherwise. If your house gets robbed, and you can't afford the police, maybe because they just took all your money, that robber can go and rob your neighbors. It's very important that you're able to call the police and put an end to this menace before it spreads. You have to be able to call the police whenever you need them, because otherwise it's a public risk. It's everybody who doesn't call the police when they have something contagious, a criminal that could go and commit a crime somewhere else. It's we simply cannot stand for that. And when I say contagious, this probably gives you a hint at what I'm talking about with hospitals. If you have a disease and you can't get treated because you can't afford a hospital visit, you can spread that to everybody else, and everybody else gets sick as a result of your being too poor for health care. We can't allow that. We cannot let that happen. Now, we don't in this system. I mean, not everybody can afford health care, but uh, that's okay, because if somebody can't pay their bill, it falls on the taxpayers. It's not a great system. We don't want to put the burden on taxpayers for just those who can't pay. But we have to allow people to get treated if they need it, whether they can pay for it or not, because of the danger. And if you go to a market-based system, as Levitt and Dubner are suggesting, and as many conservatives make this short-sighted suggestion, you simply can't do that, because we can't allow people to not be able to get health care. And of course, I'm a liberal. I am on the side of socialized health care. I think we ought to do it. Now, they're talking about how terrible it is for Britain because it brought up expenses, but yeah, there's a basic amount of health care that people need. I don't get regular checkups, and I don't, if I feel some small problem, I'm not going to go to the hospital because I know it will probably cost me a lot. I'm taking the example of the heart problem I had last year. If I break my leg at this point, I know I cannot afford that. It will destroy my credit, as if my hospital bills haven't already done that. It's too much of a burden, and it shouldn't be, because I'm a working person. I work 40 hours a week, just like you probably do. This shouldn't be the situation where people who have the merit, who are putting in the effort, can't afford to get just typical health care. That's silly. It's simply not a fair system. It's not just. So we really have to fix this system, and of course, the best way to do it is socialism. We just have to look at other countries that have done it, and they're faring fine. Yeah, it's expensive in England. Suck it up. That's just the cost of giving everybody health care. In their case, it's a greatly increased expense because they didn't have the system and now they do. And Levin and Dubner see it as people overusing the system, as if people want to go to the hospital more than they need. It's not like you can hoard healthcare. You can't resell it. It's just people who would have gotten health care if they could afford it are now getting health care. I think that's perfectly reasonable, and I imagine you do too. Anyway, I hope this gets to Levin and Dubner, and I hope they actually learn something from it. And I'll catch you in my next video. Peace out.